Hello everyone, welcome to Om Shanti Healing. In this how-to video, we're gonna go over neck pain. And I'm gonna show you some tricks that you can use with your own hands to alleviate neck pain and give your neck more freedom and relieve any aching at the back of the skull or around the collarbone area. So I want to show you with my trail guidebook here a side view of the neck. So you can see there's many layers of muscles here, and we don't need to go into too much detail on what each of those are. So just to be very brief, these muscles in the neck provide lateral flexion, so we're doing this, rotation in both directions, lifting the chin, extension, and flexion. Okay, so in unison, these can get very tight, holding up the head, especially if our alignment is off and we have protraction of the head, which looks like this. Our head is forward, ears are in front of the shoulder, as you can see, and this is a pretty common one with pretty much everybody, but given our fast-paced lifestyle, energetically we're always like pushing forward, so our body alignment is doing this because we're in a rush, right? And also, when we're sitting at a desk and our arms are forward and we're squinting at a computer monitor trying to read print, and we're all day doing that, trying to hold our head forward like this and then stabilizing, working all these muscles very hard as we're rounding, head protracting, shoulders coming forward, right? So all of this together creates chronic pain and tightness. Also, the way we sleep can contribute to neck pain and so forth. So to get right into detail here, I want to show you again. This is our collarbone. So these muscles down here, these gray ones, these are called scalenes. These are rotator muscles. This SCM, this is a big one, and you can see it right here on my neck. Mine's pretty tight all the time. And you can see it very defined with head protraction forward. Back here, that's the upper trapezius that also connects to the base of the skull and comes down over the back of the shoulders, to be very brief on that. Levator Scapulae, this guy is attached to the upper medial corner of your shoulder blades and then comes up and kind of hangs out deep to that upper trap and connects basically at the base of the skull too. Big muscles, very tight muscles, not a lot of blood flow in the back there because of all the tendons necessary to support our head in movement and to stabilize us. So front view here, just real quick. Before we get started, I just want you to see. We're going to work this guy. This is the SCM for sure. We're going to work this guy in through the collarbone. Now there's a lot of nerves in here. So when you're addressing this area with a little bit of pressure, I want you to be very mindful of any referral pain up into the temple or behind your eye. That means you're pushing too hard. Okay, so we're going to address this, and I'm going to show you the version of it standing up. You can do this lying on your back, and it might be more comfortable for you that way. Try both and see which one works better for you. Okay, so we're going to get in here, we're going to get this guy here, and then we're going to get a posterior view of the occiput in the back side. So right here's a smaller picture right here. So we're going to get our extensor muscles. So these are the muscles that contract when we look up, right? And they get very tight. And also with head protraction, holding and stabilizing back here, these are chronically tight. If we're looking down all the time with work that we do, these can stabilize and get very tight in a lengthened position, right? As the front will get very tight in a contracted position. So neck alignment is very important to just be very mindful of that. So let's go ahead and get started. Okay, so we're going to begin in the front. So I want you to just palpate. So that means just touch and explore. Bring your forefingers into the collarbone and just kind of press a little bit. And feel for the points that feel like there's no give. Like mine are right here, right? It's a little bit softer, closer to my sternum. So you want to just address what feels sore, what feels tight, what feels very congested, okay? So we're going to take our 4 fingers and kind of come right around, hook right around in that collarbone. And I want you to push in and then down, and see how gently and effectively you can hook your fingers around your collarbone. See where I'm at right there? And you're just going to gently push, relax your throat. And then we're going to turn to the opposite direction. So I'm on my left side. Visually, you're seeing a mirror image on your right. So you can go with me, mirror, or do the same side. Either way, we're going to turn to the opposite direction of where the pressure is. Okay, so we're going to slowly look over the opposite shoulder. And you'll feel those muscles start to stretch in there and kind of try to push your fingers out of that little divot. So you just want to hold the single pressure and turn as far as you can over the opposite side. And just look up, lift the chin, and then we're going to look down towards your shoulder. Let's do one more time. Look up, and then down. And come back to center, and just notice if you've got a little bit more space in there. So let's pick one more spot for the sake of not being here all day. One more spot, press in and down, get a little hook around that collarbone, and then look the opposite way. So we're going to our full range, and then we're going to look up and down 2 times. And again, you know, decrease pressure if you need to, add more rotations if you want to. You can come back over and look over that same side, and you can feel how there's an indentation there, how your fingers can sink in a little bit better. And then back to center. Okay, so I want to show you now with the SEM what we can do. Now we don't want lotion when we're doing this. We want to have a good amount of grip against the skin. So if you're lubricated, you're going to slide and you won't be able to pinch and hold. So I want you to be able to pinch and hold. So I'm going to get my SEM. You can see it as I turn. There it is, right there. It's a long muscle, and it goes all the way up to here where it attaches to the bone behind my earlobe. Okay, so I'm going to start up high, and you'll feel it. You just palpate like a finger in the side of your pointer finger and your thumb are a good way to grip it. So you want to start up high, and it's going to be the tightest up here because this is the widest part of the muscle up top. So you want to grip it. So if your head's turned all the way the opposite direction, it's going to be very tight and hard to get to. So start in a neutral position, or even look a little bit over your shoulder to the same side so it softens a little bit and it's not stretching, and then you can grab it. Okay, so pinch it, get a good grip, hold it still, and then you're going to turn your head the other way. Good. So you can feel, you can see it's pulling tissue, pulling my skin, and then we're going to come back to center, and it should feel a bit softer. So you can do the same spot again. I'm going to grip up just a little bit higher, and you want to keep it comfortable so you don't have any referrals in your temple or in your eye. So squeeze it accordingly to what your pain tolerance can handle. And then we turn over the other side, opposite way, and come back to center. Now let's go down a little bit. This one's great for head protraction, which we all have, which is that jolting head forward stuff we got going on. So grab the middle, squeeze it, hold it, and you can feel the side of your pointer finger can kind of hook into the front of it. See how I'm doing that? You hook into the front of it, squeeze it, and then as you're turning your head, you can almost pull in the opposite direction a little bit. And it may take a few times because it's going to want to bounce out of your grip as it stretches. But just keep working on it, keep practicing. Use your strong hands to grip it. Now I'm moving down a little bit here. I'm coming closer to my clavicle, my collarbone. That's where the other end of it attaches. right at your clavicle and sternum, at that joint where that intersects. That's the other end of it, and it gets skinnier and tighter. You can see the bottom of it right there. You can pinch that and turn. It gets real tight when you rotate your head. And then back to center. So you can feel once you get in there, so much softer. I don't know if you can see the difference on one side from the other. This side's not done. You can see it sticking out pretty tight. This side's done, a bit squishier, a bit softer feeling. Even visually you can tell that it's released comparably to the other side. Okay, so now to get the scalenes, which are these little muscles in between here, and we're going to get some of the levator from the front side deep to that. I want you to make, hook your pointer finger and then press your thumb into that finger. So you want stability at this lesser knuckle of your first finger. And that thumb is going to be straight and kind of lock it in so you have a nice stable pointy end with this knuckle. Okay, so we're going to go behind this SEM. We're going to start up top and we're going to push. So get your elbow out, straight out, so you can get a good amount of force this way. And again, we don't want referrals, so gauge it how you need to. So we're going to push just right behind, here's my SEM, we're going to push behind that, hold it, and turn. Good. So I'm holding it still, so as I turn my head, I'm going cross fiber over those muscles. Now let's come back to center. Good. So as many times as you need to there. Explore it and kind of do what you need to do in this area. I'm coming down a little lower. Push and turn. And then back to center. Okay. And you can come down a little bit lower. Push and turn. So addressing the side of the neck as many times as you need to with this locked in position. Okay, using the pointy part of the knuckle, working the area as low down as you can go through the neck, where you can get a decent amount of pressure, coming back to center, and maybe picking one more spot. Okay, so now we're going to get the trap area, which is right here. If you palpate in this area on your body, it's going to be tight. Okay, and it's not going to have a whole lot of give as far as softness goes, right? So the way I do this one is I use my thumb, and it's resting on the side of my pointer finger, right? So I'm going to take the tip of my thumb, and it's supported so I can't do this and crank my thumb in a bad direction. It's supported. So I'm going to place it right in there. So you can find the ridge line of the top of that trap and feel that stretched out elasticy type of feeling back there. And this one, trying it laying down might be better, but for the sake of the video, we're going to do it standing up. So I can palpate in there and just kind of feel the tightness. I'm going to find a spot where I can dive in, right in front of that muscle. And I'm going to push in and back. So from a back view, you can see. So addressing the side of the neck as many times as you need to with this locked in position. Okay, using the pointy part of the knuckle, working the area as low down as you can go through the neck, where you can get a decent amount of pressure, coming back to center, and maybe picking one more spot. Okay, so now we're going to get the trap area, which is right here. If you palpate in this area on your body, it's going to be tight, okay, and it's not going to have a whole lot of give as far as softness goes, right? So the way I do this one is I use my thumb, and it's resting on the side of my pointer finger, right? So I'm going to take the tip of my thumb, and it's supported so I can't do this and crank my thumb in a bad direction. it's supported. So I'm going to place it right in there. So you can find the ridge line at the top of that trap and feel that stretched out elasticy type of feeling back there. And this one, trying it laying down might be better, but for the sake of the video, we're gonna do it standing up. So I can palpate in there and just kind of feel the tightness. I'm gonna find a spot where I can dive in, right in front of that muscle. And I'm gonna push in and back. So from a back view, you can see pushing it away from the back of my body, okay? Opening up through the front. Okay, so now from there, you apply pressure in and back, and then you incorporate a little bit of movement. So we want to be mindful here also of referral pain. Back out of it a little bit if you're feeling anything shooting up into your temple. Okay, so a few of these back and forth. You can lift the chin and lower, come back to center, look to the same direction, play with it, see what feels right, okay? And work both sides, of course. So now we're gonna get into the posterior part of the neck. So we're gonna work the upper part of that upper trap and get into the levator and release that tight stuff that creates aching at the occiput. Okay, so right here at the back of the neck, you can palpate here and you can feel a tight muscle on either side of the vertebrae. And one side might be tighter than the other, depending on, what you got going on in your body. Okay? So I want you to feel at the top. If you go to the top, it's going to be hard, it's going to be easier to get to. So you can see that I'm grabbing onto it and I'm squeezing. So this is a pinch and pull move. Very gently pinching and pulling away to loosen up fascial layers back there and give that space a little bit more mobility. So get up as high as you can towards the hairline and pinch and pull. So you can turn to the opposite direction a little bit if you want to. See if you like that. Turn to the same direction. See how you like that. Okay? And then just let the tissue kind of slide through your fingers as it softens. And then get the next one. Pinch and pull. And a little turn. Or hold still. Whatever feels good. You might feel inclined to add a little movement. And then down to the next spot. Pinch and pull. And a little turn. Pinch and pull. All the way to that trap where we left off when we were here. Okay. Do the whole sequence on one side so you can gauge change and then switch to the other. So let's quickly wrap up with opening the front a little bit more around the jawline. Okay, so what we're gonna do is use our thumb and we're gonna tuck it right underneath here. So if you can palpate through here, you can feel points of tightness and tendininess. And this is really common with that head protraction stuff we were talking about. And also, if you grind your teeth or clench your jaw, either awake or asleep, this area could be very problematic. Okay, so we're gonna place our thumb underneath, find a spot. So this is the top of those scalene muscles where it comes to tendon and it attaches to your jaw. And we're going to place a thumb. So up and in gently, okay? And then we're going to look up, hold it. And then we're going to look down and let that thumb sink in.
let that sink in as you lower your chin. And then next spot. Just be mindful of the throat. Just use that show up. We're sensitive around here refreshing reflexes, so just be your next pressure. So the next spot. You want to feel the next spot. So the next spot. Lift in and up. And we're going to lift the muscles below the chin. And we're going to contract muscles below the chin. And we'll use the pressure the whole time. You can next spot. We'll use one more. Press in, lift, and then down, let it sink in. So you can feel the difference. Checking in for that. So tight front muscles, tight throat. If you have swelling, you have some stretches in your stomach, work on the front of your neck. Open up the muscles just all the way down and relax. That goes with your FTJ. Let's do a quick and then we'll be.
So those of you that do grind your teeth while you're sleeping or clench when you're stressed, this is a great one to alleviate that. Including this that we just did around the jawline at the bottom here, add in this one also. So I just want to give you a quick visual of the mandible. So we can see these muscles that wrap around the cheek, and we come down here for the jaw. Okay, so these muscles all together create movement of the lower jaw, so we can chew food and we can talk and everything, and it supports the bottom part of our mouth, right? So we're going to work this area here to loosen up right where the jaw hinges, right in there. Okay, so all we need to do, you can do one side or other. It seems to me, since the jaw is connected all the way around here, that it makes sense to do both sides at the same time. So you press. So I'm right in front of my earlobe, right in that tight stuff. And you can, as you palpate, you can feel what side is tighter, and is that in correlation to the same side of your neck that may be tighter. So we're going to press, and then we're going to give ourselves a good amount of pressure there, and then open the jaw. So we're opening and closing. And when you close the jaw, I want you to just purposely grit your teeth a little bit, and you can feel muscles in there shifting and tensing up. And then open again and close. A little grit, tension, and relax. Soften it up. Now let's go side to side. So we're going to press, open the jaw, send your jaw over to one side, and then over to the other. Back and forth, and then relax and soften. So doing a couple times with that back and forth, open, close, grit the teeth, relax, palpate, soften, and work around this area, all around in here, working, spending some time there to loosen up the jaw, and that will just bring a lot of release all the way down the neck. So I hope this really helps all of you. My intention is to empower and give the people that listen tools to help them to feel better. So please subscribe to my channel, because I have lots more ideas coming your way. Share this with a friend that has neck pain or jaw pain. Give them empowerment by sharing this video with them. And I appreciate your viewing all my videos and subscribing to future ones. Have a lovely week. Thank you.